Welcome to Lesson 4, Diabetes Risk Factors. When you complete this lesson, you will learn the following. 1. Heart disease, sometimes referred to as cardiovascular disease, is the #1 risk factor for diabetics. 2. What is the meaning of heart disease? 3. The causes of heart disease. High blood pressure, aka hypertension, cholesterol and triglycerides, obesity, lack of exercise, smoking. We are now going to discuss heart disease. What is it? Heart disease or cardiovascular disease creates problems with the heart and blood vessels. Some examples of heart disease include heart attack, stroke, heart failure, coronary artery disease, or CAD. Diabetics are more likely to develop heart disease and are at a greater risk of having a heart attack or stroke. Heart disease is the leading cause of death in the United States. Now that we know what heart disease is, let's talk about its causes. Heart disease is caused by high blood pressure, smoking, lack of exercise, obesity, high cholesterol, poor eating habits, and/or excessive alcohol consumption. Managing high blood pressure, also known as hypertension, is extremely important to your overall health. Let's learn about blood pressure. Blood pressure is a vital sign that measures how much pressure the heart and blood vessels, tubes that carry blood, require in order to push blood throughout your body. If the heart and blood vessels use a lot of pressure to push blood through the body, it is referred to as high blood pressure. High blood pressure can cause the blood vessels to become stiff. Blockages or buildup of plaque, fat, and cholesterol in the blood vessels cause them to narrow and may result in a stroke or heart attack. Did you know that cholesterol and triglycerides can increase your risk of heart disease? Let's learn about cholesterol and triglycerides. There are two types of cholesterol. Good cholesterol, HDL, removes bad cholesterol and stops it building up in blood vessels. Bad cholesterol, LDL, sticks to blood vessels and causes plaque buildup, narrowing blood vessels. Bad cholesterol is a waxy substance in your blood that comes from eating red meat, cheese, butter, and eggs. The body needs low levels of cholesterol to function properly, and if too much cholesterol builds up in the blood vessels, it can lead to a heart attack or stroke. Triglycerides are a type of fat found in your blood. When you eat fatty foods such as French fries, pizza, cheese, milk, sweets, and/or alcohol, the body converts those excess carbs and fats into triglycerides and stores them in fat cells. If stored triglycerides are not used through exercise, the body's triglyceride levels will increase, resulting in hardening of the blood vessels. High triglyceride levels can increase your risk for pancreatitis and heart disease. One of the biggest impacts you can make to improve your health is to lose weight. 80% of diabetics are overweight. If you lose as little as 5 to 7% of your body weight, or 5 to 7 pounds for every 100 pounds, you will likely have lower blood sugar, improved blood pressure and cholesterol, reducing the risk of heart disease and other serious complications, dramatic weight loss, which in some instances can even reverse type 2 diabetes. The two most significant factors in losing weight are 1. Reducing food intake. Reducing the amount of food you eat by 1/3 will result in substantial weight loss. Sugary drinks can add a huge amount of carbs and calories to each of your meals. Replacing soda, fruit juice, beer, and milk with water or diet drinks will significantly reduce your carb and calorie intake. 2. Increasing physical activity. Physical activity will help to burn excess fat and carbs. Walking 30 minutes per day will make a gigantic impact on your overall health. The single most important thing you can do to immediately improve your health is to stop smoking. Cigarettes are not only expensive, they also increase blood pressure, cause heart disease and lung cancer, and can ultimately lead to death. There are many programs that are entirely free or covered by health insurance that can help you stop smoking. Talk to your doctor about a program that will be right for you. Let's summarize what we have learned in Lesson 4. 1. Heart disease is the number one risk for diabetics. 2. Heart disease or cardiovascular disease creates problems with the heart and blood vessels. 3. The following conditions can contribute to heart disease: high blood pressure, aka hypertension, cholesterol and triglycerides, obesity, lack of exercise, smoking.